with the guidelines set by both the Ministry of Education and the protocols issued by the Ministry of Health. I want to appeal to all Kenyans to be more vigilant now more than ever before, so that we can safeguard our children from any infections. Those in the transport sector that are ferrying passengers, our children included, must ensure you maintain high standards of hygiene as well as adhere strictly to the containment measures. Public service vehicles must not overload, as this would be a sure way of spreading the virus. Whereas there is no cause for any alarm yet, it is important to strictly observe the containment measures to forestall any spread of the virus. If we fail to adhere to the measures, we shall have ourselves to blame in the event of any spike, as it will mean we shall go back to where we started. We are also making a special appeal to our teachers in schools to ensure that the agreed guidelines and protocols are followed to the letter. This is the only way to ensure we continue to safely keep our children in schools. As His Excellency the President recently said, we cannot afford to gamble with the lives of our children. Therefore, let's all do our part and ensure our children learn in a safe environment. Turning now to the COVID statistics, today we report 318 people who have tested positive for the virus after testing a sample size of 2,592 over the past 24 hours. This now brings to 41,937 the number of confirmed positive cases in the country. Our cumulative tests now stand at 595,791. From these 318 cases, 309 are Kenyans, 9 are foreigners, 215 are male, 103 are female. The youngest is a 3-month-old infant, the oldest is 90 years. In terms of distribution by counties, Nairobi leads with 112 cases, Uasin Gishu with 30, Mombasa 29, Nakuru 25, Busia 24, Kisii 21, Kisumu 19, Kakamega 8, Muranga 8, Kilifi 6, Laikipia, Kiambu, Embu 5 cases each, Homa Bay 4, Trans Nzoia and Turkana 3 cases each, Machakos, Isiolo, Kajiado 2 cases each, Nyandarua, Garissa, Tharaka Nithi, Vihiga and Kirinyaga 1 case each. I will go through the sub-county distribution for Nairobi, which recorded 112 cases. These come from Kibra 18, Westlands 14, Starehe 13, Langata 12, Roysambu 11, Dagoretti North 7, Embakasi East, Embakasi South, and Makadara 5 cases each, Kamkunji and Kasarani 4 cases each, Dagoretti South and Ruaraka 3 cases each, Embakasi Central, Embakasi North, Embakasi West and Mathare 2 cases each. The rest of the sub-county distribution is in the document that you will receive. So, on a positive note, today 243 people have recovered from the disease, 132 from the home-based care program, and 111 have been discharged from various hospitals where they were receiving care. This brings our total recoveries now to 31,340. And I want to take this opportunity once more to thank our healthcare workers for the good work they are doing that has enabled us to achieve these results. Sadly, at the same time, we have lost another 10 patients to the disease. bringing our fatality to 787. Once again, our sincere condolences go to the families and friends of those who have lost their loved ones. Asanteni, and I think we can now move on to the question and answer session. And I hope, as I